I hope you are all aware that the third supplemental emergency appropriations package is at Congress now, and it is being debated, I guess is the best phrase. And I think I was talking to some folks about 10 a.m., so a couple hours ago now. And the thing that's really getting in the way of this getting done is trying to figure out unanimous consent, and that the Congress doesn't really have a good mechanism right now for remote voting. And now that some members have tested positive, they're trying to figure that out. If you didn't, I'll run through the language. The basic piece that is forming the basis of the discussion right now includes $20 billion for transit, split 80-20 between 5307 and 5311. So that's 16 billion for 5307 and 4 billion for 5311. They're going to use these funding mechanisms because they're the ones that everyone's used to using, and they are really loath right now to add new bureaucratic structures. So at the state association level, you're going to hear me say this multiple times during this discussion. Really, the outreach to your state DOTs is critical. With regards, our focus on small systems, small urbans, and rurals. That's the other pieces in the bill. If you have not seen it, and if you need a copy of it, shoot me an email and I'll tag you back with the language as we had it late yesterday. Basically, you're allowed to use all this funding for operating, and that's where one of our emphasis areas around systems being able to make payroll and pay drivers and not have wholesale losses of drivers. And so it's for operating expenses to prevent, prepare for, and respond to the current pandemic. It's reimbursement for lost revenues. It can be used for the purchase of personal protective equipment and vehicle cleaning. Also, there's been relief provided here from having to have any of this funding go through standard planning processes. They have included that language as well. I'm told it's just a matter of time before this gets passed. We've been working with APTA, with our members, and kind of some of our connections on the Hill, particularly this weekend. We did a lot of heavy lifting with Senate Republican offices, particularly focusing on Senate Appropriations Committee members. This is more money than we had asked for, but in line with what APTA had asked for. $4 billion is a lot of investment in 5311, frankly. We have been urging the Hill, and I'll talk a little bit about our discussions with FTA as well, to really start to tap into a lot of public transit agencies' ability to move into demand response operations. One, because we've got a lot of members who need to continue doing things like dialysis and chemotherapy trips, and you do as well, I know. And second, it seems to us, Chris and I have had a lot of discussion about this, that there's going to be significant demand on home delivered meals, and not just for seniors, but for potentially a lot of other segments of the population, home delivered prescriptions and medications, home delivered care and testing. You know, as more and more states go into these full kind of stay-at-home situations, we want a lot of our systems to be able to be part of that solution piece. I have talked to now at least a half dozen transit agencies who have had drivers test positive. And that's a big concern, as you can imagine. You've probably heard that in your states as well. So where we stand is in this third phase, this should get done. It's just a matter of when. Our folks were telling us this week for sure. So that's kind of where we are. Yeah, Mark, and we'll open the floor up to questions, both typing them into the group, the chat, or if you want, most of you, you're doing a great job of keeping relatively quiet on a call with 30 some odd people, but if you want to chime in with a question right now, we can try that, although I don't want to have everybody kind of talking over each other. But so let me answer Mark's question first, and then we'll go to the other piece. And Mark's with the Oklahoma Transit Association. He wanted to know, can the money be used to pay drivers that are idle, either because of having tested positive, home for childcare and or service reduction? Yes, that is what our hope, and I think that is what everyone's intention is for the money. Other questions? Okay, well, know that you can email me directly and we'll get an answer right back to you, or that you can put a question into the chat box. And let's go over to what we've been dealing with FTA. So myself and Paul from APTA have been meeting with FTA leadership twice last week. We're going to try to get together again twice this week. The acting administrator, Jane, and all of her kind of leadership team, as well as some folks from USDOT. Last call, Friday early evening, we were talking about the ask and clearly congressional action, and it was good to hear that the FTA was supporting the asks and is supportive of, I think, what has been what I characterized earlier on. We're going to get to Lynn, we'll get to association stuff. We're talking transit right now, but that's a good question.
Great, thanks.
Yeah, no worries. Couple things that I raised with FTA that I wanted to share with you. One was the designation late last week by Homeland Security of transit workers being essential critical infrastructure workers. I asked FTA if they could see if that can get our members, your members, a more direct pipeline to the personal protective equipment. Obviously, we don't want to get in the way of any of that going into the healthcare sector, but in that next kind of prioritized group. And I think it's really critical that we were able to do that. So that's going to be, I think, Jane and Henrica were talking to council about how to use that designation as a way to perhaps get access to that equipment. I also urged Jane and Paul underscored that something is mundane, but next Monday, the bus and bus facilities competitive grants close. I urged her to move that back 30 days at least, but to start off at 30 days. She said that she thought that would be doable. From our town halls last week, we've posted on our COVID-19 page the questions that we kind of collected from those town halls and shipped over to FTA. I know Henrika and some of her team are working on getting answers, and as soon as I get my hands on any of those, I'll post those on the page. A lot of procedural questions on things like, hey, I've got an upcoming audit, a triennial, is that going to be pushed back? But I think one of the main things that we heard that FTA wasn't ready yet to provide clarity on was, hey, when should a system shut down, and how so? And you know, Henrika and Jane both were really clear with me Friday evening that they want that to be local decisions and not FTA decisions. Another thing that they advised was that they did know that CDC was coming up with some transit-specific guidance. Again, that would be very useful to have. When we get our hands on that, we will certainly share across this network. And I think that, again, in all of this, there's the governors at state levels are starting to take preeminence on a lot of the decision making. They're working in conjunction with statewide public health officials. And I think you, as state transit associations, we'll certainly keep you apprised once we can, you know, of everything happening at the federal level. But those connections that you all already have are going to be really important in the next phase of this. So that's kind of where we are with what we've been talking about with FTA leadership. Now, let me look at the questions here. Yeah, Jackie, yeah, you can deny a trip if that would create a threat to others. FTA didn't want to say that, just come right out and say it, but they are clearly allowing that. Elaine Haitko in Vermont asked, do we have guidance on when a passenger is clearly exhibiting symptoms? I don't know that they're going to be clear on that, but I think you need to be clear on that with your members that take safety first. And I think you're on the right side of that, frankly. Any possible funding assistance for 5310? We included that in our ask. I was a little disturbed in reading that that was not part of what seems to have been negotiated. Again, we don't have the final language. Once they agree to something, we'll look through that closely for 5310. There's talk of the way I see these things playing out is once this third bill gets signed, we're going to have Congress probably for at least 2 weeks, likely longer, not being in session. And the fourth, and I've even heard talk of a fifth version of supplemental appropriations will be discussed at that point. And maybe that's where we can work in as we start to get into the need for more of these demand response kind of operations, one-off trips, a lot of home delivery type trips. Maybe that's where we can get to dealing with that piece of it. Mark asked, has there been any clarity as to whether the designation of essential critical infrastructure worker prohibits a system from closing down? No clarity on that, Mark, but I do, I did hear FTA state very clearly they want that to be a local decision. So if you've got some agencies in Oklahoma that for safety purposes have decided to close down, I don't think anybody that's going to be running counter to any laws, so to speak. Josh asked, what is the equipment you referenced that could be accessed? What we'd like to see there, Mark, is obviously, or Josh, is going to be things that can, one, keep a driver safe as they're transporting people, particularly as we get into more of these on-demand trips. I know a lot of systems are asking people to board at the back of the bus, these kinds of issues. So it's generally called personal protective equipment, um, uh, masks, gloves, cleaning supplies, all those kinds of things are what we're talking about when we're referencing, hey, since transit workers have been designated that way, can we get better access to that? Can medical transportation trips right now be denied? Ambulance companies are denying trips. I mean, they can be, sure. I wouldn't. This is where I think we need some guidance from CDC, and we need some idea about, can a driver continue to provide trips in exactly what Shauna's talking about in that kind of scenario, if the vehicle's being cleaned regularly, if they have access to kind of equipment. Laura from Illinois Public Transit says, related to Mark's question, in Illinois, our governor specifically cited IL as essential critical. However, we've been asking that if an agency is considering closing down, yeah, good. I think it's a good way to handle that, Laura. Yeah, and I understand what you meant by what transit there. Basically saying, and this is what I said to several of our members, understanding what you're dealing with, link into the public health network as best you can at the county level, at the state level, at the local level, because they are going to need your services and trips of your members at some point, and we want to be able to play a role in the recovery as we move forward here. Good questions, by the way, everybody. If there are any others, again, put them in the Zoom chat. Obviously, ship them directly to me. Again, if you want language, we've got a lot of the language from the bills. If you want to see that, it is lengthy. And the other thing I think that has been brought up here is a lot of us, CTAA is likely to be a part of that group fairly soon. Spring and early summer conferences that many of us rely upon for funding are canceling left and right, and we're all either moving to the fall or we're gonna try it again next year. That's a reality that all of us as associations are dealing with. One thing I was hoping we could do here is have each of you who have gone through that start to take into account a financial look at what those hits mean to you, and see if we can't put together, work with the ASAE is the Association of Associations here in Washington. We've been reaching out to them to see if there isn't a way in some of the approps and or funding that's made available that we can be part of that. I don't know, honestly, how where we will stand in that pecking order, but I think it would be useful at the very least to put together that documentation as best we can. I talked to Texas Transit Association last week. Jackie in California and I have spoken. I've talked to Shauna in Pennsylvania. We're all dealing with this, but if you can start to get a sense of what that means, Taylor and L'Oreal and I on the CTA staff were happy to kind of gather that and put it forward in a collected way, if that seems okay with everybody on the call, because it is important. Agreed, Lynn. I mean, we certainly, I would share that as well with FTA. They are eager to have any data on kind of the impacts. Lisa, I'll be honest with the group here. We are recommending postponing Expo and our dates are May 31st through June 4th. We got a couple of board members, Kristen and Jackie, that are on the call here. I'm trying to get, as you can all have gone through, I'm trying to get some guidance from my conference team on renegotiated contracts and all that, and kind of understanding the financial ramifications for us. And once we gather all that together, we'll be sharing that with our board, and that seems to be where the staff is right now. Lisa, that's where we are. Margaret, it's a good point. Now, remember, RTAP funds are a percentage of 5311 funding. So part of what we're seeing flow will be very interesting to see if indeed that flows into the RTAP programs or not, based on, and that's something that I will raise with FTA on my next call, because I agree with you, additional state RTAP funding through what has been, through a $4 billion emergency appropriation could help a lot of us with paying for and kind of sustaining travel for a lot of our varying members. And Ann Gilbert reminds me, she's on the call from Arkansas, another one of our board members. So yeah, we've got 3 CTA board members that are very involved in state transit associations, and we're taking that very seriously. Other questions?
Hey, Scott.
Fire away, David.
I'll be glad to talk to you offline just about conversations with negotiating with hotel properties if you'd like.
Yeah, thus far we've had decent luck, either moving current contracts. That's what we've been trying to do, but also trying to build in, I think, lower attrition rates and things like that. We've had some decent luck with that. So yeah, but I'm happy to help.
Yeah, and I'll be glad to help you.
Yeah.
We operationally, a lot of the hotels, their ability to deliver is part of the conversation.
I would urge anybody who's considering moving to do it quickly, because everybody and their mother and every conference and gathering and event that typically ends up at a hotel, they're all moving. So, time is of the essence. Yeah, Jackie, I raised PTASP plans that are due this summer with FTA, both in writing and verbally on Friday. I'll follow up again this week and see if I get anything more on that one. They were really focused on what was right in front of them right now, which was the bus, and there was another one that that they were really focused on. I think this is Tennessee. Has anyone developed a tool for quantifying the impact on lower ridership? Has anyone done anything along those lines? Lower ridership, employee-related costs, increased cleaning, et cetera. Something that could kind of have an assessment at the state level on impact. Has anybody done that? I may have seen, Josh, have you done that at CTAA? I thought maybe I saw something from your
We've
folks.
done a survey, Scott, that we essentially have live. We're working with Jackie and our DOT transit division to standardize it, because there's an APTA survey, there might be a CTAA survey, CalAct survey, CTA survey. So in California, we're trying to standardize. We have a ton of data so far, but I wouldn't say evaluate the impact. We're measuring the measurements. We're measuring lost ridership as a percentage of where a percentage decline compared to the average daily or weekly ridership a year ago today. and we're evaluating the growing, drop towards zero of fare revenue that these transit agencies that are doing our survey are responding to. We've also begun to ask them qualitative questions about what are you doing? Do you have cleaning supplies? How are you doing the sanitation? So we have a big picture. There's 3 agencies in California that are going to shut down by June 1st if we don't get emergency funding because they're so highly fare box dependent. We've asked our state government for $1 billion in emergency relief to match, hopefully, something that the feds are doing that would help everybody. We don't have those second order effects, Scott. The traditional, are we translating that into GHG reductions or anything like that? Because it's so, I don't know, in a sense, obvious.
It is, and I think while you're on the line and talking, Josh, I think your state is a good example. And one thing that I think state associations really ought to be emphasizing right now is state revenues, and whether they're related to sales tax or property tax or other, if state by state, if you've got state transit investment that is going to take a hit, that might be something as well that I think all the state transit associations should really be starting to quantify, because it's that also after you get through ridership declines, and which equates to obviously fare box and contract revenue declines, we're getting to what is going to be the impact of this economic disaster that's likely to last through, I think, at least Q3. What's the impact like that on state revenues for those of you who have those?
Absolutely. In California, if not a lot of places around the country, Scott, the besides fare box, the core transit revenue, at least on the operations side, is sales tax based. In our survey, we've also begun to ask our member agencies to track local economies, because a lot of us have locally voted, county level voted sales tax measures that contribute a lot to transit. And we're of course tracking the impact on the economy in California. In Q3, Q4, and beyond, we assume a bigger dip for a lot of our agencies than the most fare box dependent are seeing right now today.
Yeah, and I think one other issue that I talked to a couple offices on the Hill at the end of the week last week, and one on Saturday, and that is like FY21 federal approps. The standard business, no one. One, they laughed at me that I was even bringing it up, but also the idea that they'll deal with that when they get to it. But trust me when I tell you, I don't think there's going to be, that process has been arduous. It's going to even be more so after we're dealing with that. Chris is, good point, Chris. The federal government can incur trillions of dollars in debt, but there's going to be a huge drop off in local tax collections, sales tax. The more you can do to collect that, Laura in Illinois agrees. Operating assistance equates to 65% of operating expenses are from the state. All that's going to have to find a home somewhere. And I know that's part of the reason why these asks at the federal level have been so big. But again, I'll send out something after our call here to urge all the state transit associations to start to collect as best we can. And that's going to be a big role, I think, for all of you as leaders at the state level.
This is Justin with Washington State Transit Association. Sorry, I came on late. I was on another call.
That's all right.
One of the things that I've been hearing from my members is asking what you need to know, not what you would like to know. They are being inundated by asks, and right now everybody's sort of in an emergency response situation. And so I'm keeping that in mind. We've been asked by the governor to work with DOT to track certain agencies, mostly our urban ones, ridership. And instead of doing a survey, I actually set up a Google spreadsheet. And so in fact, right now I'm looking at one agency inputting their daily ridership as we speak. So that might be a useful resource for folks, so you don't have to continue emailing and asking to fill out a survey. I've asked for them to direct a point of contact. And then this link is actually in the governor's office. They're looking at it at each day. It's specifically helping Governor Inslee make daily decisions. He is looking at ferry ridership, toll roads, throughput on corridors and transit ridership to see if people are adhering to his request to stay at home. So for my colleagues on the phone, I'm happy to share what I have with you. But I encourage kind of more of that live updating, because I'm hearing quite a bit from my members. Don't email 1,000 times. Please only ask the need to knows right now, not the want to knows. And then also, we wrote a letter to our congressional delegation specifically outlining what you just talked about. We are 87% transit locally dependent on local dollars. Most of that is sales tax. And so unfortunately for us, our agencies don't get their sales tax collected in 1 month for 2 months. So I'm actually trying to lobby the Department of Revenue in our state to give that information up sooner so we can make sooner decisions. So we actually won't know the fiscal impact on our sales tax until June, unfortunately. So those are some of the things that we're kind of trying to track and do for our members as well from that point of view. Just some anecdotal things I'm hearing and doing here.
Oh, no. Thanks, Justin. And I think that's really well said. There's a big difference between like to and need to right now. And all these things, these data points that we're all collecting are a snapshot at that moment. And then as things seem to keep getting worse, you know, a week later, that data is vastly different. So some sort of ongoing piece. And I think, you know, the ability for state leadership, like a governor and public health, to be making decisions is critical right now. And so if you've been able to work where your data collection is very limited, but it's informing those kinds of decisions, I think you're playing a really important role. Couple other questions. Yeah, I agree, Shauna. Again, move quickly on your dates. And Lisa underscores Florida being hit hard with sales tax at a time when tourism is so critical to Florida. Unfortunately, it's a very unfortunate reality. I think we're going to be seeing this for a while, and the Justin was talking about kind of not knowing for a couple months what's really happening right now, and that's important. Chris notes in terms of the bill language currently debated in the Senate, while not yet passed, would provide $20 billion in transit formula grants until expended, which can at least tide your members over for a bit of a while after a fashion. But we need to see what actually gets enacted. And yes. As a disturbing aside, Chris notes the bill has a provision that would prohibit any of these recovery funds from going to nonprofits receiving Medicaid dollars. Yeah, that's something we're gonna have to work on, Chris. Not targeted clearly at NEMT, but probably at others. Something we hope gets cleaned up quickly. Lisa mentions Florida Medicaid. We've talked to a couple other states that have issued guidance. A lot of them are wanting to only have one person in a vehicle, and we all know what that does to, I know I saw Beecher was in the call. I talked to some of our members in Kentucky that was causing some issues. Talked to some members in Louisiana who told me that the state had backed down on that. Lisa, if you can share any of that guidance with Taylor or myself, that'd be great. We'd love to, or that notice, we'd love to see kind of what you're seeing.
Scott?
Yeah.
This is Becky. I just wanted to share a little more information of a conversation I had with Don Sweet, who's the Director of Civil Rights at FTA, and just to let people know a little bit what they're thinking about, even though they're going to keep coming out with guidance. And she said they'll be coming out with guidance probably this next week on release of not having to do like public hearings or equity assessments when it comes to cutting routes, things like that, that they're not going to worry about that. I did ask for our members about prioritizing trips. They said you can't really prioritize trips, but she said work on messaging, that you can say, you know, we're in basically a shelter at home mandate, and so unless it's absolutely necessary, you can say things like that to your passengers, but you can't really prioritize trips if you're still doing ADA service. I also asked her, like one of your questions earlier, if you need to transport someone that is COVID-19 positive, and she said, yes, you can say that it's a danger to someone else. However, she said if it's, say, like for dialysis and there's no other way for them to get their dialysis treatment, you need to really weigh in what's best for the patient and the risk to the driver. Can you in some way facilitate another way for them to be treated, either at home, or do you need to make that trip? And I asked her to please put out some guidance about that. And then the last thing I wanted to say is I think we all need to advocate for relief during this time. I even asked about future reviews. Can we be exempt, like when reviewers are going out 2 or 3 years from now and they've kind of forgotten about this crisis, to not look at the data during that time period when they're doing a triennial or a state management review. That's it.
Yeah, that's a good point, Jackie. That was one of the other things we clearly raised with FTA was NTD reporting and any use of NTD data, which does get used, take into account what we're dealing with right now, whether it's STIC or other programs that are really reliant on that data. Shauna wants to know, anybody seen drivers walk off the job or kind of en masse walk away? I know we reported on a middle of the week last week, kind of full walk away, it seemed, by the operators in Detroit, but by midday that had been solved. I've had a couple of discussions in the last week with ATU leadership, just trying to get a sense of what they're advising, and how they're dealing with things. They have not obviously advised people to walk away, but I think there's also a lot of concern for their driver members about their safety and health, and the lack of the personal protective equipment is a problem.
Scott, this is Clark in Michigan.
Yep.
Yeah, you're absolutely correct. DDOT workers did shut the buses down last week on Wednesday morning. It brought out the mayor, who met with them immediately. They worked out some rapid agreements. They've been back on the job since, and taking a lot of the same kind of the protective measures that transits can take, such as boarding from the rear only, asking riders to sit a distance apart, doing away with fares for the time being. The exact opposite, though, has occurred too in Michigan. I've had conversations with some of my association members who are telling me that their drivers are the ones saying, look, we have got to stay on the job. We're essential. We take people to their dialysis treatments, to chemo treatments, and we can't shut down. So we've seen it from both perspectives here.
That's a good point, Clark. And we've reported on Charlevoix County, Michigan, where you saw the positive side of exactly what you're saying. You've seen that certainly in Michigan, and I would imagine we could point to similar examples in most of your states. It never ceases to amaze me, the drivers and their commitment, but people are scared. And fear is not a good influence on good decision making. And this is where leadership has to, and direction of these members' agencies has to be as clear as we can make it. And that's what we've been trying to impart to our members as they've inquired with us is kind of a triage of system importance, and how can we make sure the things at the top of that are going to continue because we need to. No one else can do that. And John Johnson from Mississippi, Rich Sampson down in Louisiana will remember. I remember so well the biggest challenge in the immediate aftermath of Katrina was we couldn't find drivers. We had vehicle fleets, we couldn't find the operators, and I think that's something to keep close eye on at the state level for all of you. Chris brings up, I think, a good point about statutory provisions in FY 2021 and later approach that provides a hold harmless because of what the current situation is going to do to NTD data. I mean, I think that's an obvious one, but it's something that we shouldn't overlook and I'll make sure I raise that in my next set of discussions with the FTA. Shauna says, any chance of the industry being able to join together to do a bulk purchase? Yeah, that would be one way to do it. FTA with their leadership and DOT leadership working, closely with the administration, working closely with Department of Homeland Security. That was one way I thought to try to make this happen. But let me see if there are others.
Scott, again, it's Clark in Michigan, and just wanted to mention on that point, early on here, we had several systems having difficulties with not enough sanitizer and disinfectants. We do have bulk purchasing in the state of Michigan, and they could do nothing to help us. They contacted all of their suppliers, and everyone was back ordered until at least May.
Yeah. That we've heard that from other states as well, Clark. And then every now and again, someone will say, "Yeah, I have everything." I don't know how they managed it at the local level, but they did. But it's not consistent. There's no procedure or system that seems to be working, and that's kind of what we're all looking for here.
The thing that we found here in Michigan, that the place that seemed to have supplies, the dollar stores of all places. And there's one on every corner, so they've been invaluable.
That's interesting. Anything else somebody wants to tag into? Shauna brings up CDLs. Our members in West Virginia were letting me know that they got some guidance from the state. I know Oklahoma and Mark Neslin has been working as well. And this issue is keeping available the ability for drivers to take CDLs. Has been one issue. With the one Shauna's bringing up, availability of drivers given other, yeah, exactly. I think that's going to be a fluid situation in terms of people either flooding into the CDL market or being scooped up as things move. Chris, why don't you just voice that instead of throwing it into the chat box?
All right. I've been trying to keep myself on mute, but this is just kind of a weird aside. This is actually kind of relevant to the question of sanitizer availability because Purell and companies have been overwhelmed in their distribution. The Treasury Department's Taxation and Trade Bureau has allowed distilleries to switch their production from liquor to making sanitizer, which basically is 70% or more ethanol, which they have plenty of, and they can't sell it to bars. So I know here in Montgomery County, several distilleries are providing sanitizer made to EPA spec to fire departments and hospitals. Just as a kind of weird flake away to build a new relationship in these challenged times. You might want to see if you've got distilleries in your area that are also switching their production over. They're not able to sell their traditional product to anyone because of the bars and restaurants being shut down. So it may be worth a look. And a lot of what we need to be doing in these times is building strong relationships with folks that we might not otherwise have related to. So just a morsel for thought.
That should put Kentucky and Tennessee in good shape. I'm glad somebody got that joke. It was pretty bad. Anything else anybody wants to raise? I want to be real careful with your time because I know how busy you all are. Well, absent that, thanks for joining. I want to say to each of you, thanks for all the work you're doing and stepping in. I would really, I hope that you and your families and your colleagues that you work with can remain healthy throughout this. We're here for you. If there's anything we can do, please share. Please let us know. If you think you've done something, you've gotten some better way to collect data or use that data, please share that with us, and we can share that with everyone. Yeah, Kim, definitely. We'll provide a summary of the call, and that will go out to everyone. And we can put an area on our COVID site with kind of state association resources as you share those with us. So there'd be a place perhaps for all of you to just kind of regularly look, and we'll post things there. But thanks. Please, everyone, be safe. And I think we're all working hard on this. And hopefully we can make some headway on this, and that next week it'll be a little better. Have a good rest of your day.
Thank you, Scott.